Hello everyone and welcome to SpecialEd Nexus, the show that explores the world of special education. I am Dr. Smith, your guide to understanding and supporting individuals with diverse learning needs. Today, we are diving into the topic of intellectual developmental disorder, or IDD, a condition that affects how a person thinks, learns, and processes information. Sit back, relax, and enjoy as we get the ball rolling. You may be wondering what exactly is intellectual development disorder. I can help you to answer this. Intellectual developmental disorder, or IDD, is a neurodevelopmental condition diagnosed in individuals with significant limitations in intellectual functioning and adaptive behaviors. The individual has trouble with things like learning, communicating, thinking rationally, planning, and even performing basic self-care skills. The individual may have trouble understanding complex information, expressing themselves, forming friendships, or even struggle with tasks such as managing personal hygiene. Intellectual developmental disorders can be caused by several factors, including genetic conditions. Some genetic conditions such as Down syndrome can cause IDD. Pregnancy and birth complications. Factors such as premature birth, low birth weight, and exposure to toxins during pregnancy can increase the risk of intellectual developmental disorders. Health issues. Certain health issues such as infections, malnutrition, or trauma to the brain can lead to IDD. You may be wondering, how can someone identify a person that may have an intellectual development disorder? Well, an infant may sit up, crawl, or walk later than other children. Find it difficult to remember things. Learn to talk later or have trouble speaking. Understanding social rules, seeing the results of their action, and have trouble solving problems. In some cases, persons with IDD may have physical impairments or health issues associated with certain genetic conditions. There are several types of intellectual developmental disorders. They include autism spectrum disorder, language disorders, attention deficit hyperactivity disorder, and Down syndrome. Autism spectrum disorder, or ASD, includes a wide range of spectrums and different levels of impairments. Language disorder is a type of communications deficit that affects a person's ability to understand or use both verbal or nonverbal language. This can include difficulties with vocabulary, grammar, understanding and using spoken language, as well as understanding and using written language. It impacts a person's ability to communicate effectively, which can affect their social interactions, academic performance, and daily functioning. Attention deficit hyperactivity disorder is a neurodevelopmental disorder that affects both children and adults. Persons with ADHD have trouble paying attention, controlling impulsive behaviors, or are overly active, which can interfere with their daily functioning and development. Symptoms include difficulties sustaining attention, easily distracted or forgetful, fidgeting, excessive talking, difficulty waiting turns, and impulsivity. ADHD cannot be cured, but it can be successfully managed. Down syndrome is a condition in which a person has an extra chromosome. Chromosomes are small packages of genes in the body. Those genes determine how a baby's body forms and functions as it grows during pregnancy and after birth. Individuals with Down syndrome often have characteristic physical features such as a flat facial profile, upward slanting eyes, and a short neck. They often have a range of developmental delays and may have some level of cognitive impairment. Individuals with IDD usually face a lot of stigma and barriers due to misconceptions. There are several misconceptions about IDD that are important to address. Society thinks they cannot or are unable to learn. They don't feel loved. Their disability defines who they are. They cannot play sports. They are unable to start a family. They are a burden to those around them. They cannot lead productive lives. They are all alike or one size fits all. These are not true. People with IDD have a range of abilities and many are capable of learning and achieving great things with the right support. While individuals with IDD may face challenges, they may also have strengths and talents that should be recognized and nurtured. Each person with IDD is unique and interventions and support should be tailored to their individual needs and strengths. Children are assessed for intellectual development disorder through a process called intellectual assessment. This assessment involves a series of standardized tests that measures a child's intellectual functioning and adaptive behavior. The process begins with a referral form from a parent, teacher, or healthcare provider. Next, the evaluator gathers information about the child's development, medical history, and behavior patterns. The child then undergoes a series of standardized tests that measure skills such as reasoning, problem solving, memory, and learning abilities. After this, the child's adaptive behavior is assessed through interviews, observations, and tests that look at how well the child can function in daily life compared to children of the same age. Once all tests are completed, a diagnosis is made if the child demonstrates significant limitations in both intellectual functioning and adaptive behavior. Lastly, the results of the assessment is shared with the parents and caregivers along with recommendations for support and intervention. Remember, all assessments must be conducted by trained and certified professionals. The last thing left for me to do is to provide you with some strategies to support individuals with IDD. Firstly, individualized lesson plans provide education and support tailored to the individual's needs. Secondly, the use of visual aids, simplified language, and assistive technology can provide support and remove communication barriers. Practicing social skills in various settings can also be beneficial to persons with IDD. Lastly, teaching daily living skills such as cooking, cleaning, attending to personal hygiene, and managing money would assist individuals with IDD to lead normal lives. This is Dr. Smith signing off. Join us next time on SpecialEd Nexus as we continue to explore the world of special education. Remember, every individual deserves to be seen, heard, and valued. Thank you for watching and see you soon.